Hi guys, it's Jenny with About Facing, and I am back with Janet at Ageless and Beautiful, and we are going to be watching her perform the Juvederm treatment on our beautiful patient's nasolabial fold. So the patient is numb, and Janet, just walk me through the rest of this process here.
So we're going to inject the derma filler here on her nasolabial fold. Very easy.
Would you say this is one of the most common areas patients ask for?
Very common.
Okay.
Most men and women.
And do you occasionally see asymmetry where patients have a deeper fold on one side versus the other?
Very common. It usually not all people has the same asymmetry.
Look at that. That looks great already.
It's very easy.
And it looks very comfortable.
She's very comfortable. And then here's a little bit up down turn over here.
Okay.
Just kind of little magic right here.
Oh, see, these are where we learn the special tips and tricks.
Just a little trick in here.
And that will help just with a little bit of, oh, look at that. A little bit of upturn already.
Yes.
That looks wonderful.
A little bit in here. This lady is a trooper. Okay.
So it's more than just filling out a groove. You're really working on three-dimensional changes here.
Volume.
Mm-hmm.
And also you're gonna assess, like, if this is have a down, just give a little push a little bit in here. So it's a big difference.
That looks really beautiful.
So a little bit of bleeding, but she's gonna be fine.
Great. All right. We'll watch you go to the other side here. And are you using the same amount on each side or customizing it?
I'm customizing it. Sometimes this side is a little bit deeper.
Okay.
Every time, like
I think I have
by the way, this is her first
deeper
time.
on one of my side too, probably because where I sleep.
That's one factor also. Also some women lost collagen early stage of early age, like even in their 30s.
Mm-hmm. Common to see that.
They are already losing collagen, hollow under the eye, like jawline, but she doesn't have like a lot. The jaw is more visible.
Okay.
So
you really can apply fillers to multiple areas of the face. It's not just where you're seeing wrinkles. It's really to fill out hollowness and recreate shape.
yes. Also, even this one here, you can put a little to augment her jawline.
I see. That looks really nice.
Just gonna put in here.
This is great. And this is also just a easy lunchtime procedure.
Yes, it is. This is hollow right there. Just
That
open
looks
it.
beautiful. Smoothing it out a little bit.
Smoothing it out gently. This is hyaluronic acid. This is Juvederm
Okay.
XC Plus. Usually lasts about 8 months.
That's great.
Yeah. Okay. So you have a little bit of hollow in here. I'm gonna put this tiny. Okay.
So do you find that you tend to do lots of little injections and just corrections and adjusting along the way? Okay.
Like here, you have this little hollow.
So smoothing out, giving you more of a line there.
Little volume so it doesn't.
That looks great.
Hollow in there.
All right, I'll let you finish up the magic here. And anything patients need to know about after this? Is there any kind of special care, or they can just go right about their daily activities?
They can just go back to their activity, but just remind that they will have a little bit of swelling
Okay.
the first 24 hours, and those are normal.
Okay.
Sometimes patient will see some light bruising, but it will resolve in 2 to 3 days.
Okay. And if a patient decides, let's say she wanted to be really conservative and only try a little bit, but she decided she wanted to have a little more, how soon could she come back?
Usually like in a week.
Okay.
Yeah.
So even if you're customizing it or staging it that way, you can get really to your end result pretty quickly.
Yes.
Great.
Well, sometimes patients will come back again for other areas too.
That's true.
Yeah, like maybe the lips, maybe some patients come in for their chin augmentation, jawline, cheeks, temple area. There are other areas we can use derma fillers, but she is perfect.
That looks
Thank
really
you very
beautiful.
much, Christina.
Thank you.
Okay.